Shake. Hi, I'm Anca, and this is the place to be to hear about the latest tech trends in healthcare. Today, we are diving deep into a topic that is shaping the very core of how we diagnose and treat patients: artificial intelligence. AI promises efficiency, accuracy, and personalization in medicine. But there's a catch: bias. A recent study explores how biases infiltrate AI driven healthcare tools and what can be done to mitigate it. So, the big question is, can we trust the machines that are supposed to help us heal? Welcome into the Meta Health. First, let's acknowledge the incredible strides AI has made in medicine. According to the study, as of May 2024, the FDA approved 882 AI-enabled medical devices, with the majority focused on radiology, cardiology, and neurology. AI helps interpret medical images, analyze patient data, and even predict diseases based on electronic health records. The ability of AI to process vast amounts of data quickly and efficiently makes it an indispensable tool. But here's the issue: AI is only as good as the data it learns from. And that's where things start to get complicated. Bias in AI is not just a technical flaw, it's a fundamental issue that can lead to real world consequences. The study defines bias as any systematic difference in how predictions are generated for different patient groups, leading to disparities in healthcare. AI bias doesn't just happen, it is inherited from the data, algorithms, and even the human developers creating these systems. One striking example comes from AI models trained on medical datasets that lack diversity. A study on neuroimaging based AI models found that 97.5% of the data came from high income countries, with little representation from low income populations. This means that AI models could be making diagnostic decisions based on a very narrow slice of humanity. Bias can enter AI models at multiple points in their life cycle. It can originate in data collection. If certain groups are underrepresented in the dataset, the AI would learn patterns that favor the majority. For example, an AI trained mainly on data from white patients may perform poorly when diagnosing conditions in Black or Asian populations. Second, algorithm design. Developers may unintentionally favor certain variables over others. If an AI is trained to assess disease severity based on healthcare cost, which can be influenced by socioeconomic factors, it may underestimate the needs of low income patients. Third, model deployment. Once AI is in use, human reliance on its decisions can induce automation bias, where clinicians overly trust AI recommendations even when they are incorrect. These biases aren't just theoretical, they affect real people. In a well documented case, an AI algorithm used in US hospitals systematically underestimated the health risks of Black patients compared to white patients. The reason? It relied on healthcare spending as a proxy for illness severity, and historically, Black patients have received less medical intervention than their white counterparts. Another example comes from dermatology. Many AI models used for diagnosing skin conditions were trained primarily on lighter skin tones. This has led to significantly lower accuracy when detecting cancer in darker skinned individuals. The study doesn't just point out the problems, it also discusses solutions. Here are some key strategies for mitigating bias. First, diverse data collection. AI model must be trained on datasets that accurately represent different genders, ethnicities, and socioeconomic backgrounds. Second, algorithmic transparency. AI should be designed in a way that allows humans to understand and challenge its decisions. Explainable AI can help by showing which factors influenced a particular diagnosis. Third, continuous monitoring. Bias isn't something you fix once and forget. AI models should be regularly audited to ensure they remain fair and effective as new data becomes available. And last but not least, human oversight. AI should assist, not replace human decision making. Ensuring that clinicians have the final say can prevent errors caused by over reliance on flawed AI predictions. Some argue that AI has the potential to reduce bias rather than amplify it. Unlike humans, AI doesn't have personal prejudices. It simply reflects the data it's given. If properly designed, AI could actually help correct human biases by making decisions based on objective criteria rather than subjective judgment. But for that to happen, AI developers must be very intentional about fairness from the outset. On the other hand, skeptics warn that AI is often developed by tech companies that prioritize speed and profitability over ethical concerns. If regulatory agencies don't impose strict guidelines, AI could deepen existing disparities instead of eliminating them. So, can we trust AI in healthcare? The answer isn't as simple as yes or no. AI has immense potential, of course, but it is not infallible. If left unchecked, AI bias can reinforce existing health disparities. But with careful design, diverse data, and ongoing monitoring, AI could actually make healthcare more equitable rather than less. This isn't just a conversation for researchers and tech companies, it is one that affects all of us. As AI becomes more integrated into healthcare, patients, doctors, and policymakers must demand transparency, fairness, and accountability. That's it for today. I will see you soon for another tech adventure in healthcare.